guys, this is
me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about OET writing, in which I'm going to detailedly explain about how to write a letter to a social worker. Because most of the students are having doubt what information we can pick it from the case note while we are writing to a social worker. So here I would like to give a detailed explanation regarding OET writing, in which how to write a letter to a social worker. Okay, so let's move on to the discussion. For example, when you're writing a letter to a social worker, so first we must know who is a social worker and what is their job description. And basically, in India, we are not knowing of the job description about the social worker. But here in Europe countries, social workers are playing a major role for the patients, especially who is living alone or who needs social supports. And in that situation, social worker is the one who is helping them for their needs, for their social needs. Okay, so especially what they able to do it for the patient. I could say that when the patient is migrated from one country to another country, and as they are as they have any poor economic status, like income producing activity, and when they are living alone, and as a widow or as a single parent, and regarding their children's education, and if they don't have a family GP, and also if they don't have a proper occupation, and immigration problem and visa problem, and when an international student studying in Europe countries, and when they have a problem with their health issues, and also like if they are unable to attend their exams on right time, so this and all will be dealt by a social worker. And main thing is, social worker is not a healthcare professional person who can help you for the social needs, not for the health needs. If the patient is having smoking or drinking habits, and the patient is overweight, and patient needs any exercise programs, in that situation, social worker can help the patient to get a physiotherapist, and also dietitian referral, and also she can arrange for the quit line programs for the smoking and drinking, for the drugs. So these are other things social worker can arrange it for the patient. But social worker will never ever do wound dressing, not monitoring the medication compliance, and not providing the medications or administering the medication to the patient. At the same time, social worker can help the patient to get housekeeping services, taxi services, and also she can arrange here home help nurses and home help services, and healthcare agency like home help agency, she can talk to the home help agency to provide a nurse, home nurse. So these and all things can be arranged by a social worker. So social worker is not a medical professional person. So when you are writing a letter, it is good to write after the introduction regarding the social background of the patient, because social background is the one to explaining about the needs of the patient, social needs of the patient to the social worker. So the social worker is the receiver of the letter. She must know what about the patient living status, with whom the patient is living, how the patient is living, about the house, and also what is the patient habits, and what is the patient's GP, and what is the patient's income producing activity, and how about the patient language. If the patient is having language barrier, so she will arrange an interpreter. So these are all things only can be done by a social worker. And if the patient if the patient is a refugee, so she can find an accommodation for the refugee, and for the family support if the patient is having wife and children, for their education, for their accommodation, for their food, meals on wheels service. This can be arranged by a social worker. So social worker is a person who can help the patient for their social needs, not for the medical needs. So we have to very clearly understand that. So when we are writing, maximum try to avoid writing of the past medical history, medication history, and also when you are writing a present medical history, it is not important to elaborate so many things for the social worker. But a social background should be elaborated as much as possible without leaving even a single point, like living status, habits, and language barrier problem, language problem, and immigration problem, visa problem, education problem, accommodation problem, and also patient is a refugee, so they can have a GP, vaccination, and for the driver, a taxi, and for the school, and for income producing activity or getting loans, and then she will help the patient to place in nursing home services, and also she can help them to get the home help agency services, housekeeping services. So these all are the job will be done by a social worker. And what I can write in the present medical history, which means the present medical history can be written it as a third passage. So what we can write it, patient was admitted so and so date and was diagnosed with a so and so condition. And if the patient done with the surgery, post-operatively patient has an uneventful recovery and received adequate treatment and management, patient showed good progress in his condition, he is being discharged on. So this much is enough. No need to write analgesics, antibiotics, IV therapies and this and that. That is not at all necessary for the social worker to know about it, because social worker can't do nothing in this. Okay. So only this much is more than enough to write it in the present medical history. Make it very simple and concise and clarity manner. But social background, elaborate as much as possible for the social worker. Coming to the point of recommendation paragraph. In the recommendation paragraph, in the discharge advice, if they have given continuous monitoring of medication administration, BP monitoring, and wound care management, if this and all will be given and you are writing the letter to a social worker, which means please try to avoid of writing this kind of recommendations in the recommendation paragraph. So instead of that, if they given enhance the patient's income producing activity, and they are providing like encourage the patient to participate in social activities and then they are explaining about arrange the quit smoking programs and alcohol anonymous programs, and provide home help services, housekeeping services. So these points can be written in the recommendation paragraph, because this all works can be done by a social worker. Meals and Wheels service system, this all can be done by a social worker. So the dressing, medication, BP monitoring, and also wound drainage, so these all things can't be done by a social worker. So there only we are just doing the mistakes. We thought of it, okay, these are all importance, and whatever they have given in the discharge advice, this all should be included in the recommendation paragraph while you're writing a letter. But it is not like that, because we have to be chosen, and for the social worker, what she able to do for the patient, that is the one point that we have to select it from the case note, and we have to write it and as a letter. And how we can make an introduction. So in the introduction, basically for the social worker, better not to write a continuity of the care, further care and management. Rather than that, try to avoid writing these kind of things. Rather than that, you can write she or he needs social supports from your side. So that is more than enough, because she can only support the patients for the social needs. So that can be written in the introduction. So when you're writing an introductions like Mr. X, who has been diagnosed with oral cancer, full stop, he needs social support, like that. So if you are writing to a social worker, so which means you can write that he or she needs a social support from your side. That's it. Then second passage, you have to write the social background in an elaborated manner, and don't concise anything from the social background. Don't pick the information, but you can leave past medical history, medication history from the social background. And then present medical history paragraph, that is 5 lines are more than enough, because only we are just writing patient admitted and diagnosed and received adequate treatment and management and showed good progress in his condition, getting discharged on this date. That is more than enough, rather than writing hemoglobin, like a blood transfusion done, ICU shifted to ICU, kept for the observation, monitoring the blood pressure. No, that is at all not necessary for the social worker to know about it. Social worker must to know about only the social history of the patient, not the present medical history of the patient, because she is not a medical professional person and she can't help the patient. She can arrange all the important necessary services for the patient, but she can't do anything with that. And also when you're writing to the recommendation paragraph, pick the information which is related to the social background. For example, income producing activity and a language barrier, which means that try to arrange here like interpreter, and then you can ask them to social activities and also welfare groups and quick line programs, meals and wheel service system, and arranging the GP vaccination program, and arrange for the housekeeping services and home help services. So this all can be written it in the recommendation paragraph rather than writing the patient's dietary modifications. So that and all she can't do it. Either she can arrange a dietitian to help the patient and a physiotherapist to help the patient, but she can't do all those things because she is not a medical professional person. So if you know about the social worker job description, it is easy for to pick the information from the case note, and you can make a letter in a good way and a concise clarity manner. I hope this video will help you all to write a letter to a social worker, how to write it and what points are important for the social worker. Okay, and whomever wants to join in our class, we have 40 days, 60 days, 60 days, 50 days and 30 days. Also we have a mock batch crash course, and also we are running a beginners classes. So our number has given in our description. Whomever wants to join our class, you can join at any time. Until then, bye bye.